Hello, and welcome to the panel on virtual reality and psychedelics. My name is Marta Kaczmarczyk, and I'm a moderator for this segment. Just a short intro. I have masters in cognitive science and postmasters in user system interaction. I co-founded a non-profit organization on psychedelics called Psychedelic Society of the Netherlands, which is an educational and community-oriented platform. I also worked for preventive medicine center called Longevity Center, and for one of the most renowned legal psychedelic retreats, Synthesis Retreat. So today we'll have two talks, and then we will have a panel. And the first talk will be by Skip Rizzo. And just before we start, I want to ask everyone here whether who doesn't know what psychedelics are. Okay, so there are a few people here. So just a short, like a brief introduction to psychedelics. So psychedelics are a class, it's a class of substances such as LSD or psilocybin or DMT that cause disruption in normal brain organization. So they mostly disrupt and diminish the workings of what's called default mode network. That's a network that's responsible for self-regulation. Sometimes it's called seat of ego. At the same time, psychedelics also increase connection between parts of the brain that are normally not so well connected, such as auditory and visual parts, thus leading to sometimes visual distortions or auditory distortions, sometimes synesthesia-like effects. They also kind of increase archaic parts of the brain, such as limbic system, and that can lead to amplification of emotional processes. Therefore, they are such a promising therapeutic tool because a person can, without judgment or with very low judgment, can process their emotions, they can access more self-acceptance, and they can go through some traumatic processes and traumatic emotions. And virtual reality and psychedelics, what they have in common is that they can disrupt normal, rigid, and limited everyday consciousness. And virtual reality has been shown to be effective in treatments of phobias, anxiety, PTSD, depression, and many more, while psychedelics also overlap. They were shown to be effective in treatment of depression, anxiety, PTSD, and addiction. So the first talk will be by Skip Rizzo, who's a director of virtual reality at University of Southern California, and he will talk about clinical virtual reality and psychedelics. Thank you.
Okay, well, hello everyone. I'm so sorry I can't be there in person, but this is the digital age, and we'll try to prevail from afar. So let me share my screen and get us started. I'm hoping everyone can see that now. Somebody give me a high sign. It's okay?
No, we're not seeing the screen.
Yeah.
There we go. All righty. Well, I got 20 minutes, so I'm going to talk fast because there's a lot to get through here. I'm going to do a little presentation on the use of a clinical model for psychedelic therapy, integrating it with the virtual reality. It sounds like a simple concept, but there's really a lot of moving parts here that we have to consider. And just real quick, I'll do a quick intro to clinical VR, talk about the way it's used, and then talk about its integration with psychedelic therapy. My conflict of interest here is I work with Brett, one of the other speakers that'll be coming on in the panel, Brett Leonard, in a company with a group of other folks called Virtual Psychedelics. It's focused on this area, in addition to my work at the University of Southern California Institute for Creative Technologies at the MedVR Lab, where over the last few years we've developed applications in psychognitive, motor, and virtual human applications for clinical purposes. So I'm sure if you're at this conference, I don't need to recite the definition of VR. Basically, it's one of our favorite technologies, create simulations, integrating various enabling technologies that can put people in a variety of contexts where, as the person introducing this talk so aptly put about disrupting the normal flow of what we call the default mode. And in its clinical application, best metaphor is aviation simulation. So just as an aircraft simulator tests and train piloting ability, we can test, train, teach, and treat psych, cognitive, and motor functioning in a range of controlled, simulated environments. It's a psychologist's dream, really, when you look at it from that perspective. And some people say the ultimate Skinner box. Now, since 1994, the area got its traction back then doing applications with exposure therapy for specific phobias. The graphics were quite primitive, as you see there. Fortunately, graphic technology, along with a bunch of other enabling technologies, have improved quite dramatically since those days. So, but more importantly, the applications, the use cases, as you see on the right, are quite broad and diverse, and there's a growing scientific literature that justifies the application of VR in this area for a variety of reasons. This is beyond the scope of the talk, but it's just a short list. If you're interested in more, send me an email. I cover all these things in this paper, but you can distill it down to 5 core processes that I think is important to know: expose, distract, motivate, measure, and engage. So when we talk about exposure, it can be for PTSD, where you help a patient to confront and reprocess difficult memories, or more mundane applications for people with fear of public speaking.
These results are promising. What impact do you think it may have in the future?
So helping people to confront the things that they have an irrational fear of or have been traumatized by, and to reprocess that. And there's a variety of reasons that is an effective approach at that particular focus. But the science has also evolved as the technology has evolved in the last 20 years, documenting this is a valid and evidence-based approach for treating these types of clinical conditions. And this is for the PTSD work, showing significant improvements there. The second area, distract. This is a pain distraction application so that you get a sense of a child maybe wearing a headset laying in bed and getting to play a game that takes them away from the doldrums of their hospital experience and so on. As with exposure therapy, we see in meta-analyses strong clinical effects in this area. Motivate. This is an old video of a stroke patient doing a rehab task, and if you watch his interaction with that red ball, this is what we try to drive right there, that extra push. We can motivate people to do things that might be perceived as repetitive, boring, frustrating. And again, the data from multiple studies shows continued improvements with the delivery of VR in this case. Measurement, well, it's a controlled stimulus environment, in this case, a virtual classroom for testing kids with ADHD under a range of realistic and controllable conditions. And that work, as well as work in other areas of cognitive function, has shown dramatic specificity in terms of diagnostic information to improve diagnostic decision making and so on, as well as training brain function. A lot of work happening in those areas as well. Finally, engage. We can engage people in clinical applications or just using VR to engage them in whatever experience you're aiming for by using these types of activities, these game-like activities. And it has a real impact on clinical applications. When people were given a choice between traditional therapy for PTSD versus VR, 77% chose VR. Also, I want to just pause this, a virtual patient working with clinicians for training them in motivational interviewing in a randomized controlled trial showed significant transfer of training to the real world. We can engage people in this kind of learning with characters
Hey,
like this.
how's it going? I'm good. Look, this is my wife's idea.
So that's also an area where successful results in randomized controlled trials have documented the value of this. So with that intro to clinical VR, what about virtual psychedelic therapy? Well, as stated earlier, we can disrupt the rigidity of sensory experience with psychedelic substances that are, quite remarkable in a certain way. And I don't know if you recognize Timothy Leary there. I highly recommend this article for a good primer into the integration into this area, where they talk cogently about what the different factors are that may contribute to the value of an integrated model here. And what are the clinical issues here for this? We'll get to the fun stuff in a minute, but there's a growing body of evidence for both approaches. In fact, these two fields have grown in parallel from the 90s, where people were sort of skeptical or didn't get the point. But over the years, people have done the science in both areas to document the individual values of these technologies. Most recently, of course, the MAPS project with Rick Doblin and a large crew of folks at Johns Hopkins showing MDMA-assisted therapy really having a positive effect on treating PTSD. However, there's no guarantee that there's additive value by integrating VR with psychedelic treatment. I personally believe there's a high potential here, but there's a lot of issues to consider as we walk that path. The folks that are doing psychedelic therapy often talk about set and setting, and I think VR is well suited to help a person adjust their set to prepare for the experience, and give them a little bit of an idea of what may be in store for them, and prepare them for the types of issues they may want to challenge in their psychedelic experience. Setting, of course, what's the setting that the psychedelic therapy takes place? How can you craft that experience to maximize the value that it gets for a person? I want to add a third S to this, and I call that sustainment. And that is, by doing things in VR in a psychedelic session, can we then revisit some of those VR experiences after the psychedelic session with a standalone headset that can be given to a patient or client to take home with them, and revisit some of their experiences that they had during those pivotal moments of the psychedelic experience, and get benefit that will generalize further into real world functioning. We're not saying you're going to wear a VR headset or be in a pod or whatever delivery mechanism for the whole period of time, but at strategic junctures, it may be useful, whether it's to calm a person during the beginning stage or to help them confront challenging issues that are relevant for them at later points in the experience. So the key here is customization to patient needs and what are the therapy goals. This is not about recreational psychedelic use. Patient safety and well-being in clinical endeavors always has to be at the forefront. And so to do this properly, we need a model that can guide the safe exploratory research needed to advance our understanding of the connection of these two processes, and to support clinical implementation. And one other issue, I mean, this is the standard of care, and that may be completely valid. I mean, it certainly is. We get good clinical outcomes, and a lot of times there's a lot of ketamine clinics and so forth, where in the United States anyway, where you go in and you wear a blindfold, or folks are there, and that there's a focus on the inner world when someone's having psychedelic experience. And I think that's great. But can we go beyond that? And, is the medicine the therapy, or is it what's done? Is the medicine or the psychedelic substance just setting the stage for people to explore their issues? I certainly, am not going to say we have the science here to document this, but I think that we can craft experiences to enhance the therapeutic experience. Other people I've talked to say, no, it's an inner experience. VR would be a distraction. This is what we need to study. We need to understand this. We need to have a good dialogue to move forward in this area. So other folks have been doing this for a little bit. This is a group that has used spherical video, primarily of nature experiences, with ketamine.
I think what we've seen over the last few years we've been doing this is that the ketamine suspends that a little bit. It takes you away, dissociates you from this false autobiographical loop that you have going on in your mind, and allows you to kind of take yourself into a better space and hopefully remodel your own mind and get to the point where you start replacing that false narrative with a better and more positive narrative.
So that's a rationale for the implementation here, dissociative remodeling. Nice term. I think we need to study this a little bit better and start documenting this. There are other groups that are focusing on this, Firefly VR, Ketamine One, now working with OVR, a scent delivery system, to try to add that multisensory component. Of course, people always come out of the woodwork thinking they came up with the idea first and try to patent it. And hopefully this won't be a disruption to people that have been working in VR and in psychedelics and thinking about these things for a long time and implementing them. A lot of prior art here, but that's life in the patent world. So what we need is a clinical model, and this is to guide therapeutic efforts as well as promote the research and help clinicians have a guide point if they want to explore, and if their patient wants to explore, the combination of these two approaches. So you got to keep in mind, again, this is a clinical endeavor. What are the goals of the patient? What is their diagnostic or transdiagnostic condition? And how do you foster clinical gains and existential growth? So the model is very basic to begin with at this point. We have 5 components of this model for understanding how VR could be usefully implemented. I'd like to wheel through with examples really quick. I think I've got about 8 minutes left. So interactivity versus passive. Is anybody going to play Beat Saber? But that's set up as an extreme on one end of the continuum, as opposed to more passive activities, things that create a setting that can serve to guide you through an experience without having to really interact in a full body fashion. It may be a little bit of both, but these are options on this end. Another element of the model is realism versus surrealism. Some clients are going to like nature scenes in spherical video or real life places. For other clinical aims and goals, maybe more surreal content would be useful for the client. So again, these are sort of extremes on the poles of this element of the model. As I said, nature scenes, classic work by the Dolphin Swim Club, real spherical video of a dolphin pod, versus more surreal content that's 3D graphic based and hyper real, as we see on the right with the blue, and things that can mimic reality in very convincing and compelling ways. We can also think about the sensory modality. So visuals without any sound, which would be kind of boring to me, but it may be useful in the session, or selecting your individualized audio soundtrack for this, versus multisensory applications.
Welcome to
like the Magic Horizons work with guided imagery,
and relax.
Narration.
You are here in a safe location, enjoying a wonderful relaxation experience.
Another element of the model, social versus private. Sometimes people's issues that they want to confront is their social skills and social interaction in the world, but other times the experience needs to be more private. And this is an experience from a company out of Poland, Tier 1, that is very calming, very relaxing, and just a little interactive. You end up painting a mandala that pops up out of the ground and so on. But, can we use online chat rooms with virtual humans for interaction with other people? Is that going to be useful for promoting some element of engagement in the psychedelic therapy? There's also more hyper-realistic avatar-based interactions. For some folks, it is about their interactions with people in the world, not just places. So can we develop things that help people to confront the issues that are challenging? And rather than just using having to require a person to drive these avatars, maybe an AI coach, guide, sensei trips it.
Hi, I'm Ellie. Thanks for coming in today. I was created to talk to people in a safe and secure environment. I'm not a therapist, but I'm here to learn about people and would love to learn about you. I'll ask a few questions to get us started. And please feel free to tell me anything. Your answers are totally confidential.
So that might
okay
be a little over the top, but it gets across the point that we can use AI and virtual human technology to support an interaction in some ways, if crafted specifically for the needs of the client and the clinical goals that they have. Finally, is it activating or calming? And this might be for the beginning of a psychedelic experience to help somebody, perhaps somebody who's never done this before, become more calm as they go into the experience. But then for folks that have a more directive, there might be a more directive therapeutic process that you want to engage them in. So with exposure to different clinical condition applications, fear of flying, that previous one was with Dan Freeman's work looking at paranoid mentation or delusions, if you will, the sexual trauma experience that we had developed a few years back. A whole range of these areas, and it really has to do with what are the goals of the patient? What are they interested in? Have you given them a good clear theoretical and clinical rationale for what they're doing? And is it relevant? All these different elements of the model, I think, show the diversity of content that can be brought to bear in the therapeutic experience, and the diversity of clients and their objectives. So a lot of different strategies. Some of my final points is it best to use head-mounted display. Of course, now these are low-cost solutions with a lot of compelling content, but is somebody having a psychedelic experience going to want to wear a headset? So what about pod type technologies or projection displays that are individualized to the user? What about using virtual patients, like one of the apps I showed before for mindfulness training? Motivational interviewing training, maybe for training psychedelic therapists. VR has another role. I think we can pretty much all agree it's the therapeutic perspective agnostic, wide range of approaches people bring. In some cases, it may be just more existential exploration. Let's try to stick to the science here. I know there's some challenges in society with trust and expertise in science, but that's what we got to do. We're in the midst of a revolution here, a renaissance, some people say. We've got good data, we've got a positive vibe going, we've got the technology maybe to support that if the science bears it out. Let's not screw it up. We saw in the early days with Timothy Leary sending his students home with LSD over the weekend and having them come back and report on their experiences. I don't think we can do that, nor should we. We have to take a more serious scientific approach to be able to promote the value of these areas. So to conclude, setting, and sustainment, integrating VR with what we know to be effective elements of its application. We've got good theory to support this. We've got good scientific support in both areas. Low cost, high fidelity technology, and a passionate development community. Those are all the ingredients for success if we approach this from a thoughtful clinical model. So with that, thank you for your time and attention. Again, I wish I was there, man. But anyway, next year. And thank you. Bye-bye.
Okay, thank you so much, Skip, for your great talk. And I will ask you to join us for the panel. And now we will have a talk by Brett Leonard, who's a Hollywood director, and he directed a cult classic called The Lawnmower Man. That was one of the first movies that discussed virtual reality in mass culture.
Sorry, we have a slight miscommunication with Brett regarding the times. So Brett is not online at this moment. So what we can do is, well, we can bring on the panel. We can just start the panel conversation and do the panel with Skip. And if we get a reaction of Brett, we can plug him in a little bit later. Okay. So I would invite the speaker and the panelists to come on.
Okay, so two other panelists that are joining me are Patricia Pisters, who's a professor of media studies at University of Amsterdam, and Marco Akil, PhD candidate at Spinoza Neuroimagining Center. Maybe if you could introduce yourself a bit more detail.
A little bit, okay. Yeah, so my name is Patricia Pistas. I work at the Media Studies Department of the University of Amsterdam, where I'm professor of film and media culture. And at the moment I am teaching a course on film and psychedelics and other mediations of the weird. So I'm much more on the side of the cultural dimensions of psychedelics and film or media culture, virtual reality by extension. Yeah, I think that's as an introduction that might, be okay.
Hi, my name is Marco Hill. I am, as Marta was saying, I'm a PhD candidate here in Amsterdam at the Spinoza Center for Neuroimaging, where I do mostly fMRI and vision, so computational models of vision. And I'm also the founder of a little non-profit organization called Amsterdam Psychedelic Research Association, which, as the name kind of suggests, is dedicated to the scientific and academic aspects of psychedelics and other understudied substances and practices. So I am more on the scientific academic side of psychedelics in terms of my interests. Yeah, thank you, Benjamin, for inviting us to this panel.
Okay. Thank you for introductions. I want to start with actually going back to Timothy Leary. Skip mentioned Timothy Leary, and Timothy Leary coined the term cyberdelics. So he was trying to look into synergies between psychedelics and cyberculture. But as we know, he went very over top in terms of psychedelics. So how we can prevent that cyberdelics won't be also like, it's not the concept that's so over the top, and what parts of the merger of virtual reality and psychedelics are, in your opinion, acceptable, or what parts would you consider are too much?
That's a really important and also impossible question, because, of course, I think that I think a few things have been mentioned already by Skip. One element that is really important in today's psychedelic renaissance is, of course, the fact that there is a lot of care in taking precautions, in taking care of set and setting, and I think that is a first condition. Virtual reality, of course, has its own challenges. I think combining, I just actually learned now about how, and I think that could work. Yeah, having a psychedelic treatment with all the precautions that are part of that, and then being followed up with VR, because of course one of the differences, I think, between VR and psychedelic experiences is the bodily experience. Of course, the visions and that can really help retrain our brain are they can be really similar and simulated, but the bodily experience, that is sometimes really, it's part of it, and it has to be part of it, but it's also maybe sometimes not, or it might be too much to repeat that too often. So in that sense, I think a sort of careful trajectory of how to combine that in order to keep the psychedelic effects alive and integrate them into life, I think that could work very well. But both technologies are and psychedelics are even more. The other difference is VR is controllable. It's a controlled environment. Psychedelics are not. Even though you can take care of set and setting, etc., but you never know exactly what's going to happen. So there might be really a lot of benefits also for people who need psychedelics, but actually it's irresponsible to have not enough control, or in vulnerable patients, maybe. So it might be also a matter of instead of. So I'm not sure if it always needs to be combined. But that's what I could say, maybe.
Thank you.
Sure. It's obviously a very complex question. First, what I'm mostly concerned about, I guess, both in the context of psychedelics and VR and in general of this integration, is that there's a lot of interest because it looks to be like a pretty revolutionary kind of treatment, for several psychiatric condition. So there's a lot of interest on the business side. So I'm a bit concerned about the greed of certain companies. We've seen, Skip briefly mentioned, there's a lot of approaches that try to patent specific molecules or specific kinds of therapy. So I'm a bit concerned about the developments on that end in terms of also of merging with VR, and I hope that people that approach the space of psychedelics and VR, even from the business side of things, do it in a way that has a strong ethical component, because I think that is the main danger that I see going forward. That if you try to cut corners, there's going to be issues and not just for the specific company or the specific person that tried to cut corners in order to get a few more clients or to make their treatment sound more appealing. There's going to be repercussions for a lot of other people in the space. So I guess that's one of my concerns, probably the main one.
Okay, and Skip. Skip, you're muted.
I agree with everything that everyone said so far. These are important issues. And, you know, I think I look back, I was asked to do an interview about 5 years ago about whether virtual reality could create psychedelic experiences, you know, and, you know, people do all kinds of activities to try to get into that state, short of, you know, taking any of these agents. But I was really kind of negative that, you know, VR is from the outside in, psychedelic experience inside out. Maybe there's a place for them to meet, but the pharmacological effect of psychedelic drugs is not something I believe that anyone can induce, and I could be proven wrong, but can induce using VR. So where does it fit? I don't know if I would have gone into this area 5 years ago, because, you know, I always used to say, you know, it's tough enough selling VR as a clinical tool sometimes, even though it's intuitively apparent for us. And then you add in a second controversial approach. Well, I don't think psychedelic therapy is so controversial anymore. Certainly we're in a beginning stage, but the data is really good. You know, something like 2/3 of people after their first psychedelic experience in a therapeutic context say it rates up there with the top 5 experiences in their lives. That's powerful medicine. So, you know, I think VR may have a role in shaping or crafting the experience, preparing people, of course, before crafting the experience in a way that fits good clinical models, I mean, you can't divorce this. This is now a healthcare application, and it's got to be treated that way. So I think there's tremendous power here, and I'm going to shut up here because now my partner in crime, Brett Leonard, is here to join us.
Hi, everyone. Can you hear me?
Hello, Brett.
Hi.
Yes, yeah, we can hear you.
Sorry I joined late. I thought the time was a little later, but I'm here. And I think, you know, in terms of the ethical concerns for myself, that's really where all of this started for me as a storyteller. And when I made The Lawnmower Man, which is now the 30-year anniversary of The Lawnmower Man is next year, you know, it was to look at what are the cautionary elements of virtual reality as it comes into culture. And in that, you know, in that movie, we showed it being used with drug therapy to create this sort of uber-human who then became, of course, diabolical. There's a picture of him behind Skip right there in his screen. And then, you know, when I met Skip, you know, what's amazing for me is to have that story be something I'm now entering into for real with our company, Virtual Psychedelics, and, you know, bring a healing modality to the use of immersive media, the use of immersive experience, virtual experience, which, you know, now because so many people are focused on it because of the, you know, the announcements about the metaverse and all of this. And of course, those of us that have been in it for 30 some years are, you know, it's not a new thing for us. But, you know, I think that there's a lot of trepidation around what does this mean, especially when we see what was presented around that. Is this really the metaverse world we want to move into? And I think we have to really lean and focus into the ethical use of immersive experience and virtual experience for healing and wellness, because there is great wind in the sails in that use case. There's actual data that shows that this is something that could be very positive for people, as opposed to all the potential negative effects that, of course, I sort of told stories about in a fantastical way many years ago. So it's an incredible time right now for us to really take the platonic responsibility to utilize, as creators, to utilize what we're doing in a way that is truly beneficial for people, because there's so many things that this creates. It, you know, hardwires neuronic pathways. There's brain plasticity issues that are the same that happen with psychedelics. So we need to really look at these ethical concerns, which I think is what everyone was talking about when I joined, you know, as the primary concern of what we're doing as creators as we enter this new immersive era that we're at the cusp of right now.
Okay, thank you. And maybe digging even deeper into some ethical and other kind of considerations, because I like what you said, Skip. There's a big difference that psychedelics are inner experience, and virtual reality is kind of outward experience, and that outward experience is created by someone. So it's like a narrative that someone is putting on us. So how do we decide what kind of narrative should be there? And also, how do we make sure that this human contact is also there? Because a big part of psychedelic therapy is human contact and building trust between humans. And finally, how do we make sure that this technology is not addictive? Because the mobile phones we have and social media, they are actually very addictive, and they are sometimes even leading people to depression. So how do we make sure that this technology is actually not making people feel worse?
These are three big questions.
Yeah, so you don't have to, maybe I kind of put all those difficult topics on, so each of you can answer part of it.
Well, maybe I'll just pick up the first question about the narratives, and I'm sure Brad has a lot to say about that too. Of course, it's really hard to say which narrative should be told, but I think there are a few examples of. I think if you look in media culture and look at the narratives that were out in the 60s and 70s and compare them to the narratives that are out today, more related to the psychedelic renaissance, there are really interesting new elements coming up. And I think one thing that we can see if we just look at the narratives from the outside is that a lot of the narratives in the 60s and 70s, let's say the hippie exploitation film or acid westerns, they were all very much related to a rebellious youth culture. It was, and psychedelics also was really connected to freeing, first of all, freeing from older generations, and then also it moved into Vietnam protests, and emancipatory ideals. And you can see that also in the films. So there is a sort of resonance between the narratives out there, the type of images that are so-called psychedelic aesthetics of the images, and what is happening in society. And I think today we can see something really interesting going on. If we look at contemporary narratives and maybe look at, let's say, the acid western again, we see that it's much more related to healing, care, even the acid western. There is a filmmaker, Jan Kaunen, who made Blueberry, and that's a western. It has very classical western tropes, but it is actually really about healing through psychedelics, and it is actually a narrative about care and healing, and relates therefore, I think, to discussions that we have now. And the difference shows also very clearly the difference. It's not a Western where everything is destroyed that we know of Westerns. It's about integration. It's about healing, and there is another type of Western, or another contemporary Western that shows a similar kind of element of the contemporary psychedelic renaissance, and that is Bacurau. It's a Brazilian, let's say, political Western where the entire village becomes the hero of the Western. They take psychotropes. They are very knowledgeable about plants and traditions, and I think that's another element that is really it's important in today's psychedelic renaissance, and that's the elements of indigenous knowledge that we have to respect, go back to, etc. So that's another field. It's the healing and medical field and the shamanistic age-old traditions that are and that you can find them back in contemporary narratives. So that's, I think, from the outside, I think it's interesting to look at these narratives and see how we can assess or understand what's happening now on a cultural level, as well as what's happening in therapy and in relation to the old traditions that we find back, or actually, they were not our traditions. They are, Amazon traditions that, are really a part of the psychedelic renaissance today. So that's.
All right, thank you.
I'm gonna try to say something about the part about addiction, maybe. That is, so psychedelics themselves are not addictive by both physical and psychological measures. And I think one thing that I think is appealing in this sense about therapies that involve psychedelics, at least some of the current approaches, is that they're based on one or two experiences. So in contrast with a lot of standard therapeutic approaches, which are based on a prolonged course of action of a substance, for example, if you think about SSRIs, antidepressants, they're based on someone taking a certain medication on a daily basis for a long period of time, whereas the concept of psychedelic therapy is more of a time-contained intervention. So it is something that there is a preparation phase of therapy, there is an experience, and there is an integration phase generally. So I think that it's perhaps a worse business model than something that you're continuously taking. But again, it intrinsically sort of prevents that. At least if it's posed in this kind of way, it should prevent that people could even get addicted. But in general, for those that don't have experiences with psychedelics, it's generally not a particularly fun experience. So it's generally not something that people want to repeat soon or even ever sometimes. Just the other thing I wanted to say about the narrative part, which is also very interesting. It's a very debated topic within psychedelic research, because a lot of what is going on now is within the research. You can track the narratives around psychedelics within neuroscience over the years. You can see what was going on in the 40s and the 50s. There was a lot of interest in psychiatry of people thinking these drugs could be treatment for certain disorders. Then you can see what happened with the war on drugs in the 70s, the 80s, up to the 90s, where the psychedelics were studied as models of psychosis. So they were studied as substances that induce symptoms similar to psychosis. So there was this kind of intrinsically negative kind of narrative. And then you can see the switch in the last 20, 25 years, where psychedelics have been sort of rebranded, scientifically rebranded as mystical experience-inducing compounds. So a lot of more of a positive kind of narrative, and we moved away from the word hallucinations a lot, because hallucinations carry sort of a negative connotation. Because hallucination is something that you see that is not there. Yeah, it's interesting to track this, and it also poses a lot of ethical questions, because it's not a certain narrative might be beneficial for even you could have a pragmatic approach and say, oh, if I as a therapist, if I do my facilitation of a psychedelic experience with a specific narrative that this is gonna spiritually enhance someone or give a mystical experience or whatever you want, I see a positive outcome. And so, you can take a pragmatic approach and say that's a good narrative. On the other hand, you can have a more critical kind of approach and say, okay, it doesn't necessarily mean that if something leads to a positive improvement, that maybe is it a comforting delusion that we're inducing in people or not. I don't think it is, just for the record. I don't think this the insights or I think some of the insights that you'll get on psychedelics are comforting delusions. I think not all of them are. So, but it is an open question, and I think, just to finish, I think the way the way that I hope to see things going in the future is sort of in a pluralistic kind of way. So I hope that there's going to be more than one narrative, let's say, that is allowed to be used, and that it's not mutually exclusive for different narratives around psychedelics.
Okay, thank you. Skip, Brett, would you like to add?
Well, let me add one small element here, and that is you brought up the topic about the human touch of therapy, that a clinician, a person, whether they're a psychologist or whether they're in some other role to help support the client. I think that's essential. This is the technology does not. That's not the therapy. The technology doesn't fix anybody. It's simply a tool in the hands of a well-trained clinician that has done the proper history taking, diagnostics, all the things that part of normal therapy, and then develops a treatment plan around the patient's needs, where the technology and the psychedelic experience may be brought to bear. We're really talking about this as a tool where the clinician could be like the Wizard of Oz and craft an experience that's relevant for what the client's needs. And that experience may be 5 minutes, and then the next 2 hours is spent processing it. When we did, traditional VR therapy, old school neo-Luddites in the field would say, oh, anytime you bring technology into the clinical setting, you're putting a wall between the clinician and the patient. And that's just faulty reasoning. We found that a lot of times, particularly with the PTSD work, that clients who would normally say to a fresh, wet behind the ears psychologist, what do you know about war? You never served. But now, because the clinician is orchestrating an experience in VR and seeing what that experience is based on the patient's narrative, clients are saying, I feel like you understand me. So we can use technology as a way to enable a therapeutic experience, but not to replace the clinician. And it's the same thing on the psychedelic front. I mean, as I work in this area more and more, I'm seeing so many parallels between these two areas, where if we do it thoughtfully and keep our eye on the science here, hopefully we can have some additive value and make a difference here.
Yeah, I agree that really the human factor, the human touch aspect, is something we need to look at, both from these parallel tracks that are happening, the psychedelic renaissance and the immersive virtual reality renaissance of creating health and wellness through media, which of course goes very counter to the traditional narrative around media. I mean, since all forms of media have come about, there's always been many naysayers and apocalyptic visions around this, and some of which seem to have started to come true. I mean, at the beginning of the internet, it was going to save the world. There was all kinds of positive, and of course, social media, the same thing. And there were moments there where it felt like this is about interconnection. Now we see it, dismantling the nature of representative democracy in certain areas of the world. And so really now, with the incredibly more powerful medium of virtual reality, of virtual experience, we need to understand that this is the moment for us to set the bar of that narrative and shift it. The other thing that people on the panel, indicated was the truly epic millennial long story and narrative of the indigenous history of psychedelic use. I mean, the plant medicines, the entheogens, this is something that has been around for a very, very, very long time and has a tremendous positive and ritualistic history within many indigenous cultures. And because of what happened in the 60s and 70s, which was an important point of inflection, it hasn't really been looked at. I, as a storyteller, see that as the truly epic story of psychedelic, this new psychedelic renaissance that needs to set context for what this is, just like we need to set context for what the true virtual experience renaissance is all about. That we need to focus that content, because right now it's the confusion around both these things is kind of massive. Even the languaging, has not been decided upon in either one of these parallel tracks. And the way in which the technology we use to actually create cogency and all of that is narrative, is story. That's what affects humans more than almost any other technology in the history of the world. So, for me, I'm always looking at this from the standpoint of storytelling and setting the context for this incredible moment we're in on both these parallel tracks.
Okay, great, thank you. Maybe there are some questions from the audience. Does anyone? Okay, yeah, go for it.
Can I ask a question to Brad? So I was actually wondering if you would, or I believe you are remaking Lawnmower Man, but if you are making it, what would you like to emphasize now? How would it be different from the classic one? Yeah.
That's great, because it's very different. Actually, I'm the project's called Lawnmower Man Reborn, and I'm designing it as a virtual story world in which people can interact with the elements of the story, and in a more utopian focus as opposed to a dystopian focus. Because for me, I'm kind of sick of dystopia. I think we've done it amazingly well. I've loved dystopian stories and movies my whole life. I've told a few stories around, the irony for me, having been part of popularizing this idea of virtual reality, is that was a cautionary tale. And so I want to sort of move into seeing these more positive use cases and seeing how that can, that can affect the world in a future version of what the Lawnmower Man would be about. Obviously, there has to be conflict and drama. That's the nature of narrative. But you don't have to have it be set in something that is absolutely dystopian. So a more utopian view of what technology can do to help us interact as human beings, for us to truly come together as global humans, as opposed to these fractious things that media has been creating, even to the greatest degree ever in history recently. And just again, to tell a story that has that inspiration behind it, as opposed to the inspiration of telling a cautionary tale. So that's my intent.
Great. Thanks.
Yes, okay. we do have a question here from the audience. This is from the Laval virtual world. First, let me see. I see someone saying, seriously, amazing research. Thank you so much, Skip. Another person saying, excellent presentation. So those are for you. Question for Skip. It seems you're mostly using digital VR, say animated VR, instead of 360 video. Is there a reason for that, do you think? Or do results show that digital animated VR is more effective?
That again is an empirical question, and certainly we're not. I showed a couple of clips of spherical video that can be brought to bear in this approach, and certainly one of the most common things that people going into a psychedelic experience talk about is the desire to be close to nature, and spherical video, allows us to get vantage points and experiences things that you might not ever experience in your life. I just saw a really great spherical video the guy had attached as he climbed the summit of Everest. I don't think I'm going to get to go there in person. So I think again, the content is driven by the patient need and the clinician expertise, and hopefully the model that I laid out will kind of provide just guideposts as to what the options are for crafting these experiences and doing things that might have some sustainability over time. So I'm content agnostic. There might be stuff that's available on the Quest store or whatever, or bespoke things that are designed specifically for the user, whether it's spherical video or 3D graphics. So, let's face it, 3D graphics, it's a little bit harder. It's not like just setting a camera up or putting it on a drone and so on. You got to build, code. But it also affords you the opportunities for interaction and for creating things that are otherworldly, beyond what you might capture with spherical video. So I'm agnostic when it comes to the source of the content. To echo what Brett's saying, I firm believer in narrative brought into virtual worlds. I mean, that's the core. Experiential learning and storytelling is the core of how people get the most information. Yeah, you get information reading a book and listen to a Death by PowerPoint lecture and on and on and on. But putting it in, and this is where VR is so powerful, creating these experiences and adding a narrative element where there's the story of your life review type of a thing. Maybe that's where we're going, where, in the future, software will be so good that clients can bring in representative photographs from different decades of their life, and somehow a piece of software can transduce those into a life path exploration. That means there's so many options here. We're not, and this is where the headset versus a pod experience may be relevant. It doesn't always have to be 3D graphic exploration in a 3D world. Sometimes it's just the array of media that serves to evoke an emotional experience or relevant episodic experience that has positive carryover beyond the session. So thank you for that question. Good question. But the thumbnail answer is, we need to try everything and study it.
Are there any more questions?
Is there a question from the audience? Yes. Yeah. We also have more questions from the virtual world, but first let's go to this gentleman over here.
Thank you. Great work, by the way, all you. So I wanted to ask you guys more about how to position this group of people. This movement is, a group of people trying to research, give the necessary attention to the topic, and then we can, test this and have people looking around. So we have this group of people doing this, but we also have a bunch of other people outside doing whatever they want with, both technologies. For instance, I was a bunch of times in ayahuasca sessions in a religious setting, all legal, all this kind of stuff in Brazil. I'm Brazilian. And I was also on ayahuasca sessions outside this setting, which was just like, let's do it this way, and that's it. So the same thing is going to happen, and it happens with VR, and this is going to be the same with both together. So how to, position this group of study in front of this other public, let's say. What do you think about it?
Well, I think that's why we need to set the context now at the beginning of these, really powerfully. And that gets down to telling the best story about it, telling the best story about how this is a healing modality more than the other aspects. And the interesting thing is that from a business standpoint, the healing modalities around virtual experience and psychedelic research are all really where the wind is in the sails. That's a great thing. So there's something happening even in the capitalistic sense that is focusing it in this direction because people want to feel better. We're in a world where we have not only a pandemic, viral pandemic, but we have a mental health pandemic. And so we need to use these pivot points right now as a way of setting the tone to really set context. I think that's the biggest challenge going on, is that there's a tremendous amount of confusion around this, both in the terms and languaging and what are the intentions. And so really the only thing I know how to do is tell a better story.
Yeah, so thank you for the question.
Could I add something here? One thing, I think the question also brings up is we want to be able to avoid the sins of the pharma world of the past.
Yes.
We are talking about a pharmacological agent here, and certainly major drug companies are looking at this and other companies that are emerging in this area. And let's face it, medicine, heals people, in very powerful ways that might not be possible in other ways. But certainly there are alternative methods that don't necessarily require standard pharmacological approaches, and considering that is important. But the business of pharmacology has a lot of problems in addition to all the good that it's done. You know, for every great vaccine that makes a difference for people, it helps people to engage in their life again, as we all know. You know, you've got these other cases where drugs were rushed to market, or where there's incredible side effects. You know, and why does that happen? Well, the answer to 99 of 100 questions: money. And so, you know, whereas money is going to drive a lot of this renaissance, and hopefully if we shape it right in very positive ways, we have to be careful that, you know, the past sins of the pharma world are not replicated in something that has such tremendous power.
Okay, so I agree with what Skip was just saying. I think we touched on that a bit earlier as well. So I think in our time, there's a strong focus on, we were just mentioning that too, on feeling good, or like feeling better. And you know, medicine as well has that kind of paradigm a lot. We want to make people feel good, we want to make people feel better. Of course, on a physical, you know, level, that's I think that's a good idea. You know, we shouldn't be in pain, like walking around. But at the same time, it's not, you know, I don't think it's necessarily that should necessarily be like the North Star, like the only like thing that we aim at, you know, that we should feel good all the time. And I think, you know, psychedelics don't necessarily go in that direction. You know, I think there's a, you know, psychedelic experiences can help you feel better about themselves, maybe in the long term. But it's not a quick fix. So that's one thing that I like about the therapeutic paradigm of psychedelics. It's not necessarily, although it's phrased like that a lot of times in the media because it sounds better, but I don't think it's the maximum benefit that it can give is as a quick fix to like a problem makes you feel better. It's maybe more of an idea of you know, of a catalyst for growth, I think, is what I like as a better paradigm. And you know, the other part of your question was that there's always people doing whatever they want, and is that a problem, or if that was kind of like the sense of your question, at least in the. I do think that in the clinical side of things, we have to be as careful as possible. You want to have, you know, strict exclusion criteria. You have a controlled setting. At the same time, so on the science side, of course, we want to avoid like the errors that we did in the 60s of getting too enthusiastic and allowing the hype about that psychedelics can give to override kind of the more rational, the more skeptical, the more critical kind of arguments. But on the other hand, you know, and this is my personal opinion, doesn't reflect the opinion of AFRA of the association. I'm happy that in my ideal society, I would like people to be able to, you know, to have experiences with substances without, you know, in a legal way, and without being having the additional fear of you know, doing something illegal and having to procure a substance that is illegal, so not knowing exactly what it is, and that carries some risks. But I also don't think, I don't necessarily like the approach of the idea that you can remove all the risks, you know, because I think it's an illusion that even when you bring someone in a clinical setting, you can try to reduce risks, but you don't want to present something like a psychedelic experience as something that is risk-free just because you do it in a controlled setting. And you know, I would like there to be better and better information for people, and then the people could choose whether or not they want to have an experience in a very controlled, scientific, you know, lab-like kind of setting, or if they want to go do it in the jungle. I mean, you know, like then they take their own responsibility, and yeah, I would like that plurality of choices to be available.
Yeah, I think you are right. There is a lot. It's not just in controlled settings that psychedelics are being used and more used. So it is just happening. So I agree. I think what really is necessary is more. Not only more information, but more stories about it. We need to talk about in the open about it, about maybe even education, risks and benefits, decriminalization where it's possible. And I think there is a responsibility on the therapeutic uses and scientific trials to do this really right, because it also opens up the portals to talk about psychedelics also in all kind of other contexts, because it's everywhere. It's just so I think the portal really has a lot of responsibility to open up doors to really make this a societal debate as well, where you're not immediately kicked out or seen as somebody a drug addict, or all the prejudices that are connected to psychedelics in particular.
It's always,
sorry, yeah.
I'm saying that the story of psychedelics has always been about transformation and evolution, right from the very beginning of human history, and so it's that transformation evolution. We need to set the context for that. That transformation evolution is not always about feeling good. It's about evolving both individually and the species in a way that that is positive for the greater whole, including the Gaia, including the planet itself. And that aspect of this is something that I think we have to bring into the media component. We have to bring that into the idea of this immersive media renaissance, that we are about transforming and evolving human culture, evolving human interaction, and for lack of a better term, really it's about spiritual evolution. And it always has been. My own psychedelic experiences have always been focused in that realm. And so, I think that bringing that kind of focus and story into the context of how these two things work together is essential.
I just want to comment on what was said here, because you mentioned social responsibility and making sure that society is informed in terms of psychedelics. But I feel like adding on top of that virtual reality treatments and combining the two, that increases the need for social education and kind of responsibility. And the question is, how do we make sure that this is controlled in some way, that there is a conversation? Because we already can see that some ketamine clinics are already adding virtual reality to treatment, and there's no research on the topic. So I feel this is a bit of problematic area that we need to talk about more.
I definitely agree. Ketamine is the tip of the spear because it is relatively available. What is it? J&J produces a variant of it that's regular prescription. So you're seeing ketamine clinics pop up all over the place, and like the Charisma pitch about the cognitive dissociative remodeling. I think that's a good concept, but it needs to be fleshed out. There's a lot more than just putting somebody in a natural experience and hoping that some magic happens. There's certainly high potential for that, but therapy is about a guided experience, and it's not always easy. Good therapy involves raising anxiety levels at times, helping people to confront and reprocess difficult experiences. So I think this is a very important area to look at. And with ketamine probably being where it's going to be the biggest lightning rod. A lot of times you have great ideas, but you end up with a great idea, paints a bullseye by the naysayers on you. And now you're the target of increased scrutiny, and people that have attitudes negative towards media may have a field day with it. To that point, I posted in the chat a survey that we've put together to assess attitudes about psychedelic therapy and virtual reality. So the link is in the chat. If you go there, it should be 10 minutes. I tried to keep the survey to 10 minutes, but trying to get a feel for people that have either delivered psychedelic therapy, have gone through psychedelic therapy, or people considering it or have done VR therapy. So, we'll have this link on the Virtual Psychedelics website as well. I'll post that in a minute in the chat. So if you don't get to it in the chat now, but that would be really, we really need to start at a real beginning level here to make sure that we're informing all of this by the science and understanding how people think about this. So
that's our focus at Virtual Psychedelics is to really do the clinical trials that are going to be necessary to really figure out how these different substances with different virtual experiences work together, what has greatest efficacy in terms of when in the process. I think there's a tremendous benefit for virtual experience to be used in onboarding someone into the idea of doing a psychedelic therapy session, because there's a lot of there's a lot of stigma around that. There's a lot of things outside the room of this whole renaissance that people don't understand. And so again, setting context with these immersive media is probably going to be the first low-hanging fruit of what we do, more than doing it in the middle of a session that is already a very internal experience. So yes, the studies need to be done, and that's really the focus we have to focus on right now, because it's emergent. We're not there yet.
So regarding the links Skip is sending, we can put them in the chat of Virbella so that they're there, and we will also publish them in one of our newsletters, wrapping up after the show somewhere next week. So then the final words now for you, Martin.
Just a question to you, Benjamin. Do we still have time for Brad's presentation, or?
I think I included it in the answers. I think we're fine.
Okay, then we're gonna close the panel. Thank you so much for your opinions and for your input.
Yes, and I also want to say, so there were quite a few questions still in the Virbella chat. So we as an organization, we will go back and see, maybe there's another time, a session we can organize in Virbella so everyone can ask their questions to Skip, because I'm sure you will be happy to answer each and every one of them.
Okay.
I got plenty of time, sure.
Do we have time for like final remarks from the speakers? Do you want to add anything?
Final remarks. Well, this is just the beginning. I think, what I think is really interesting in all these discussions is that when I think about, the personalized kind of medicine that virtual reality tools need to be, listening to Skip, I also think of the aesthetics of how to create these worlds that are also believable. And so I think what is really interesting, and of course it's going on, but it's still emerging, it's this collaboration between artists or filmmakers, storytellers, and the medical sciences, which I think is really one of the biggest challenges, but also where possibilities lie. And that's just on the therapeutic side of it, and there is the whole societal side which needs much more discourses and stories, but also connections to legal systems, etc. So we need a big societal discussion and debate about the legal and illegal sides of these substances, which needs to be revised in order to do it, move this forward safely, I think, yeah.
Absolutely. Yeah, I think this is emergent. We're at the beginning, even though there's been a lot of us been in some of these areas for a very long time. And, we have to look at the entire process of how we produce these kinds of content, for lack of a better term. It's really experiences we're producing in a very different way than the sort of industrial revolution based version of production that has been still at the core of media production. We're really world building, and to your point about this is really a different multidisciplinary process that has never before been attempted, with bringing in tremendous amounts of different disciplines and expertise sets in order to really, establish a base for what this kind of production would be and what the intention of that production is. So really this idea of world building is at the core for me. And that is a big question. I mean, there's been a lot of talk about virtual production techniques. That's really Hollywood doing very small toe dipping into what these new tools actually provide. We need to think in a new holistic manner about how we approach the creative process itself in the context of creating immersive environments and virtual experience from the very beginning. And I think that's the subject of a whole other panel, really. But that was my final thought.
Okay, thank you. Marco?
Well, closing, first of all, I'm happy to see that at a VR conference there is interest in psychedelics. I think that's definitely a positive sign, for the development of the interaction of these fields. Again, you were asking just now how you control, how do you control this? And I was just saying, people can go into the jungle and take stuff. So that's where I see, as I was saying earlier, where I see the risks more. It's not from individual use; it's really from companies, trying to make a quick buck, by selling something that has not necessarily been researched on. So I'm in favor of a decriminalization kind of approach for psychedelics, but I think let's say the market side has to be kept with some regulations, because I think that's where the majority of risks could come, and yeah, that's it, I think.
Thank you. Skip?
Yeah, sure. In the VR area, in the clinical VR area, for years we've talked about how it's essentially an interdisciplinary field. There's no one field or profession or discipline that can do it all well. You got to bring a team together, whether it's clinicians or clinically oriented people, computer programmers, graphics, storytellers, interface designers, AI people. I mean, it's a big tent. Now you add in the psychedelic element to it, and it's like interdisciplinarity on steroids or on psychedelics, whatever. And it's necessary, and it's a beautiful thing. I mean, what field do you get to work in where you're not locked into your silo? Where you can have ideas and not have to be an expert in all of them, but be able to rely on the expertise of others that have a shared vision and goal. So I think there's great opportunities ahead, as long as we, keep our eyes on the task and maintain our ethical focus. I'm optimistic about how this is going to go. I think we're really in a positive direction right now.
Okay, thank you. I also feel optimistic, but I feel we need to talk much more about this topic. It's the merger. It's such a new area, and we need more panels like this to discuss and listen to people from all kinds of worlds, and so they can express their concern and see how we can create the narrative for virtual reality and psychedelics combined. All right, thank you.
Thank you.
Thank you.